Hello everyone, I'm Dr. Aditya. I'm a consultant in arthroscopy, shoulder surgery and sports injury at Alani Hospital in Powai. So we'll be discussing about ACL surgery. So you have met a surgeon, you have been told that you have a torn anterior cruciate ligament in your knee joint. You are considering to undergo the surgery. Now, what are all the questions that you need to ask your surgeon? How do you mentally prepare yourself? What are the outcomes? So we are just going to slightly focus on these topics. ACL surgery is probably one of the most common arthroscopic surgery done across the world. It's a keyhole surgery that is done through very small cuts around your knee joint. The results of an ACL surgery are very good and individuals are able to get back to their full level of activity after the surgery. However, before getting into the surgery, few things you should be aware of and few things you should be discussing with your surgeon. So, first thing is you need to ask your surgeon what grafts are you going to use. So, there are multiple choices of graft materials which can be used to reconstruct the ACL. One is the most common, that is the hamstrings. The hamstrings are a group of muscles on the inner aspect of your knee joint. They are mainly responsible for bending your knee joints. Typically, the hamstrings are the safest graft to be used and a preferred graft in recreational athletes because it causes least amount of morbidity. It gives us a very good graft which has a tensile strength which is nearly 4 times that of a native ACL. And worldwide, probably it's the most common graft used. The side effects are few. Some people can have pain in the back aspects of the knee joint immediately after the surgery, but generally that goes away. Some people may have some numbness or abnormal sensation in the shin for a few months after the surgery, but again that is also over a period of time. But what about athletes? What do we prefer in them? So in athletes, what we prefer is a bone patella tendon bone graft. So bone patella tendon bone graft is taken from the front of your knee joint. So if you have a look at your knee joint, this is your patellar tendon or the kneecap. It forms a structure known as patellar tendon here and it inserts into the shin bone here. So bone patellar tendon bone graft is essentially taken from here. It's a very good graft and it's one of the oldest graft material used. This is the graft which gives the fastest recovery and we can do an accelerated rehabilitation with this. So typically this is a graft which we prefer for athletes. And typically by using this graft, without using anything artificial like fiber tape and all those things, we can do a fast rehabilitation and we can resume sports typically by around 4 months after the surgery. However, there are certain downsides to this graft, so that is why it is generally preferred in athletes. So one, the incision which we use for taking this graft is going to be bigger than what we use for a hamstring graft. Second thing is, some people who have a habit of kneeling down, like somebody goes to a church for a prayer or somebody is doing a namaz, so they can get pain in the front of the knee joint when they are kneeling down. And not everybody gets that, but that's an issue reported with this graft. Sometimes your kneecap or the patellar bone can fracture when you take the graft. Very rare thing, but should be aware of that. So this is a graft of choice generally in athletes because it gives a faster recovery and a faster rehabilitation, but a downside of higher risk of any associated issues. The third graft which we use is from your ankle. So typically the ankle we use a tendon known as a peroneus longus. So peroneus longus again is a very good graft. It gives a very good diameter of graft. And typically we use this graft if we are considering the revision scenario, that is somebody has done an ACL surgery, it has not worked out and again he needs to undergo an ACL surgery. So this scenario is quite rare. It happens in less than 5% of individuals, but yes, it exists. So this is a graft which we prefer for that. The second population where we prefer this graft is in women because sometimes the hamstring has a variable diameter. Sometimes you can get a very good thick graft, sometimes you can get a very thin graft. So, minimum graft diameter which we accept which can give a good stability for your knee joint is 8 mm. So, typically with the peroneus longer, you can get a graft even up till 10 or 11 millimeters. So it's a very good graft material. The downside of this graft is there will be an additional incision around your ankle. Other than that, this graft is quite safe. So lastly, the other graft is the quadriceps tendon. So this is your knee joint. This is your quadriceps, that is the front of your thigh. This quadriceps inserts into the kneecap. So from here, the quadriceps tendon graft is taken. So again, since this incorporates a bone into it, the healing is good. However, usage of this graft is recommended with caution. As the age of the individual increases, the collagen in the quadriceps degenerates over a period of time. So typically in an individual above the age of 40, quadriceps tendon doesn't give a very strong graft. This is in fact weaker compared to the native ACL. So this is something which is preferred only in younger individuals. Other downside is people can develop a lot of weakness of the knee joints post usage of this graft. So this is a graft generally which we don't use at our institute. Second thing which you need to discuss with your surgeon is what all to expect after the surgery. So initially after the surgery there will be some amount of swelling around your knee joint, and as you do your physiotherapy, swelling will decrease. Some people may experience a bit of numbness at the graft harvest site. So over a period of 2 months that decreases. Other thing which needs to be discussed with the surgeon is what implant are they going to use to fix the graft. So there are multiple implant choices. Typically the graft is fixed to the thigh bone or the femur with the help of a button, and to the shin bone with the help of a button or a screw. Alright. So button is essentially made up of something metal known as a titanium. Titanium is an inert material, very safe, and it has been used since ages in orthopedic surgery and associated with very low risk of complications. Are made up of a substance known as beta-TCC or beta-tricalcium phosphate, which forms normal bone over a period of time. Screws are something which are preferable when we are using a bone patella tendon graft, and typically screws have been invented for that. When we are using a soft tissue graft like a hamstring graft, use a button on the side of the shin bone of the tibia also. So that gives a very rigid initial fixation, allowing us for a faster rehabilitation. So this is the concept which we use here to perform the surgery through a technique known as the all-inside ACL reconstruction, where your hamstring is used to construct a very strong graft. So there are a total of 5 hamstring muscles. Out of that, we take only one of them and use that to reconstruct the ACL. It gives a very good diameter in an all-inside technique. What we create is known as a graftling, and we don't create tunnels. That is, we don't drill through into the bone, but rather we create sockets on each side and we fill the graft there, fix it on both sides with buttons.